Okay, so today's presentation is about adult vaccination and why vaccines are not just for kids. My name is Christopher Foote. I am an RN, Passport Health Project Nurse, and my co-host today is Alicia Bell, an MD. She is our preventive medicine resident. I'm going to be doing the first half of the presentation. She's going to be doing the second half, and then we'll finish up together with the summary. So let's get started. So today's objectives are to recognize the importance of immunizations throughout adulthood, identify the routine vaccinations recommended at ages 19 and up, discuss the illnesses and complications that adult immunizations help prevent, and describe how to find reliable, up-to-date evidence-based resources on vaccination. Vaccines then and now. So vaccine is defined as a product that stimulates a person's immune system to produce protection from a disease. That is exactly what a vaccine is. Vaccine development is a very specific process regulated by the FDA. Any vaccine that is licensed has to go through that process. It doesn't matter what kind of vaccine it is, it always has to go through that research process, and that's very closely regulated, not only by the FDA, but by other organizations as well. History has shown that the very best possibility of disease eradication is through vaccination. So for example, smallpox. Smallpox vaccines generally are not given anymore because for the most part that disease has been eradicated. And then just to touch on COVID-19 for a moment. There are vaccines actually currently in development for COVID-19, and they truly will be the best protection combined with safety precautions for protecting against COVID-19. Obviously, safety precautions should still be taken: social distancing, hand washing, masks, etc. Just like for flu. During flu season, we have to practice those kinds of safety precautions. And for COVID-19, there's no exception as well. We should still be practicing safety precautions, but a COVID-19 vaccine is truly the best way for that disease to be eradicated. Why are adult vaccinations important? So just to go back to COVID-19 again, adult vaccinations are important not only for the reasons listed, which I'll go through in a moment, but also because they help keep you healthy. And they, especially right now with COVID going on, this pandemic, it's even more important for you to be healthy and up to date on your vaccines, because those vaccines protect you from potential complications, which we'll talk about in a moment. All right. Vaccines are recommended throughout people's lives. It's important for you to stay up to date throughout your entire life, not just as a child. There are a lot of illnesses, hospitalizations, disabilities, deaths that occur in adults that can be prevented with vaccination. And many adults, ages 19 and older, don't know their vaccine status. So tetanus, diphtheria, and pertussis, usually known as DTaP or Tdap, and hepatitis A and B. And then on average, only about 27% of adults are actually up to date. And there is a reference below. You can find that information on the CDC website. So disease prevention, vaccines can help prevent spreading disease. If you're vaccinated against a disease, you're already helping prevent spreading that disease. Vaccines help prevent complications from vaccine preventable illnesses, which we'll go into a little bit more detail about in a few. People with chronic conditions who get vaccinated also decrease the risk of developing illness due to vaccine preventable disease. And if you didn't receive your routine childhood vaccines, You can still be vaccinated as an adult. A couple examples of those are HPV vaccine and meningitis. Now, there are still age limits on HPV vaccine, for example, but it's definitely something worth talking to your healthcare provider with if you're not sure about those vaccines and what your status is. And then again, if you're unsure of vaccination status, you can actually have your blood drawn to check your antibodies or your titers to see whether or not you have ever gotten the vaccine, whether or not you have the disease and are now protected against it, like chickenpox. So there are definitely ways to find out what your vaccination status is. This chart just lists some of the routine vaccines that are recommended for adults. So Hep A, hepatitis B, that Hep A and B, which is called Twinrix. That's a combination vaccine of the two. The two pneumococcal vaccines, there are two different ones, and we'll talk about those in a little bit. Tetanus, diphtheria, and pertussis usually is in one vaccine called the Tdap, or TD, which is just tetanus and diphtheria. The shingles vaccine, and then obviously flu vaccine as well. Flu vaccine, which is recommended yearly, will be discussed in a separate presentation, not in this one. So we're going to talk about some vaccine myths and determine whether or not they're true or false. So to start with, vaccines infect you with the illness they are supposed to prevent. Is this true or false? I think most of you probably already guessed that this is a false statement. It is that, they cannot infect you, vaccines cannot infect you with the disease that it's designed to prevent. And vaccines work by giving the body a killed or extremely weakened form of the disease organism. And usually it's only part of that disease organism, not the entire disease organism. And this exposure produces antibodies to that disease, which helps provide future protection against the disease. Vaccines contain unsafe toxins, true or false? This, again, is false. It is not true. Today's vaccines use only the ingredients they need to be as safe and effective as possible. Each ingredient, so every single ingredient that's used not only in the vaccine itself, but also in the production of the vaccine, it has a very specific purpose to provide immunity, to keep the vaccine safe and long-lasting, or, as I said, is just used for the production of the vaccine. So, for example, traces of formaldehyde, which is used during the vaccine production, may remain, but the amount is so small compared to the concentration that's found naturally in the body that it doesn't actually pose any kind of safety concern. So natural infection is better than immunity you get with vaccines. This is definitely false. Natural infection does not cause better immunity than vaccination. So on the pro, both vaccine-induced immunity and natural infection can create antibodies that help protect against future illness. However, natural infection has a risk of serious complications like liver failure, paralysis, blindness, deafness, permanent brain damage, or even death. So truly, vaccination is the better way to go. And at this point, Alicia is going to take over.
All right, so now that you've heard about some of the myths that are popular about vaccines, let's talk about the vaccines that are recommended for adults. Hepatitis is a serious liver disease, and major causes of hepatitis include the viruses hepatitis A, B, or C. Hepatitis A is spread from person to person through feces due to poor hand washing or from infected food, water, or contaminated objects. Symptoms of hepatitis A include fever, fatigue, loss of appetite, nausea, vomiting. In children, severe stomach pains or diarrhea may manifest, and jaundice is something you've probably heard of, where there's a yellowing of the skin or eyes. This can also cause dark urine or clay-colored bowel movements. So you may think that, okay, in the United States, we don't have to worry about hepatitis A, but that is not true. As you can see here on this slide, there have been outbreaks reported in the United States, such as in 2016, there was a multi-state outbreak of hepatitis A linked to frozen strawberries. And so this caused over 100 cases across the country and resulted in 56 hospitalizations. We had our fair share of cases as well. At the bottom of this slide, you'll see that there are cases that reported this year so far in the state of New York, excluding New York City. And you can see there are 35 counties that report over 300 and something cases of hepatitis A. At the top of this slide, you'll see a clip from a news article talking about a local restaurant that had found that they'd found hepatitis A. And were trying to communicate to people that had they eaten there, they could be at risk for contracting hepatitis A. So we definitely recommend the vaccine. You need this vaccine if you have a specific risk factor for hepatitis A, or even if you just simply want to be protected from this disease. The vaccine is usually given in 2 doses, 6 to 18 months apart. And some of the increased risk factors include travel to certain countries, chronic liver disease or HIV infection, street drug use, homelessness. If you are a man who has sex with men, there's an increased risk. And just if you want to be vaccinated to avoid future exposure, that's also a really great idea. Now, hepatitis B is one of the viruses that can cause either mild illness, a mild form of hepatitis, which is acute, or it can lead to a chronic and pretty serious lifelong version. Hepatitis B is spread when infected blood, semen, or other body fluids of a person who's infected enter the body of someone who's not infected. So in the short term, acute symptoms can be fever, fatigue, some of the other symptoms that we saw with hepatitis A. Chronically, this happens if you're infected with the hepatitis B virus for a long time. At some point, you may not show any more symptoms, but this can lead to serious liver damage, such as cirrhosis, and that can lead to liver cancer or even death. So the hepatitis B vaccine is definitely recommended. Again, you need this vaccine if you have any of the specific risk factors that we talked, or if you simply just want to be protected from the disease. Again, this one is in 2 to 3 doses as a vaccine that just depends on the brand, which one that you receive. And some of the increased risk factors include some of the same things as hepatitis A, but one of the things we really want to stress is that increased risk factors include having the diagnosis for diabetes, having existing liver disease, HIV infection, or even other chronic conditions. Now, the hepatitis B vaccine, and some of the other increased risk factors include travel, if you're receiving or will be receiving dialysis, and if you've been in contact with someone who has been infected with chronic hepatitis B infection. And you can see here a graph that shows that cases have gone down in the United States over time, but we've got some groups where, such as between the ages of 50 and 59, where those number of cases are starting to increase again. So it's important to be vaccinated against hepatitis B as well. Hepatitis C, we do not currently have a vaccine available for, but there is treatment available. Another important disease that affects adults specifically is the pneumococcal disease, and that is basically any illness that's caused by the pneumococcal bacteria. Most of these infections are mild, but some can result in long-term problems such as brain damage or even hearing loss. Meningitis, so that's an infection of the covering of the tissue on the brain or spinal cord. Bacteremia, or infection of the blood, or pneumonia caused by pneumococcal disease can actually be fatal, especially if you're a person who has certain medical conditions, if you're age 65 or older, or if you're a smoker. Now, we definitely recommend the pneumococcal vaccine if you are younger than the age 65 and have certain high-risk conditions, such as asthma, heart, lung, or kidney disease, if you're immunosuppressed for taking some sort of drugs or have cancer, or if you're lacking a functioning spleen or you're a smoker, you'll need one or both of the vaccines. Now, the Prevnar 13 vaccine or the PCV 13 is one kind, and the Pneumovax 23 is the other kind. And that is something when you're at age 65 and older, you want the PPSV 23 or the Pneumovax 23 vaccine. You may also be given the Prevnar 13 vaccine if you hadn't had that before earlier in life, but that would be after a discussion with your healthcare provider. Now, a couple important vaccinations that we really recommend throughout the lifetime is tetanus, diphtheria, and pertussis. Tetanus is caused by a certain type of bacteria found in soil or dust, and that can enter the body through cuts or puncture wounds, like you're typically stepping on the rusty nail, that sort of thing, without having shoes on. And some of the symptoms include what is called lockjaw, or the painful cramping of the jaw, or even painful cramping of the muscles. And this can actually lead to problems swallowing, breathing, or even death. Now, diphtheria is a type of bacteria that makes toxins that make it difficult to breathe, can cause heart failure, paralysis, or not being able to move, or even death. And before vaccine programs were widely implemented, diphtheria was one of the leading causes of childhood death worldwide. So some of those symptoms that we used to see a lot were swollen glands in the neck, sore throat, even skin infections that can cause ulcers, and complications are paralysis, pneumonia, and lung failure. So pertussis, this is one that you've probably heard a lot about in the news recently. Pertussis, or whooping cough, as it is kind of known for, is caused by a bacteria that spreads from person to person. It can be deadly for babies, especially those under a year old. So many of these symptoms include like the rapid kind of whoop, whoop coughing, followed by a kind of high-pitched sound. It's oftentimes uncontrollable, very violent, can cause vomiting even, or difficulty breathing. So in babies, apnea, or having long pauses in breathing, can often be the symptom they present with, and they may not even have a cough. So it's important to make sure that adults are up to date with the pertussis vaccine to help protect children. So this vaccine, usually it's the Tdap, as Chris mentioned earlier, or TD. So the TD is with the tetanus, diphtheria, versus the Tdap has both of those plus the pertussis. So if you hadn't received one of these as an adult, like a Tdap, you'd want to get one now. Then you'd get a TD or a Tdap booster every 10 years after that. You'd want to make sure you consult your healthcare provider if you don't remember if you've had at least 3 of these kind of tetanus, diphtheria, toxoid containing shots at some point in your life, or even if you end up with a deep and dirty wound, you'd want to call them to be assessed. Another important thing is that all women need to get the Tdap dose during each pregnancy, and that's recommended as well for any family members. If there's a newborn in the house, if those family members aren't up to date, they should get the Tdap vaccine as well. Shingles is another issue that we recommend being vaccinated for. Shingles is something that occurs when the virus of chickenpox reactivates. And so shingles doesn't necessarily pass from person to person, but it can cause chickenpox in someone else who has not had chickenpox before or has not had the vaccine. Another thing, though, that you need to keep in mind is even if you've had the vaccine, you are still at risk for shingles. So some of those symptoms include itching or tingling of the skin, usually followed by a pretty painful rash on one side of the body. You can have headaches, chills, fevers, upset stomach. But the most common complications of shingles is nerve pain or post-herpetic neuralgia, which is the mouthful, and that can last for months or even years after the rash resolves. Another serious complication, if you get the infection kind of along the eye and on the face, is that that can lead to serious blindness and involve the eye. So that's a pretty serious complication. So we definitely recommend the shingles vaccine. If you're at the age of 50 or older, you should get the 2-dose series of Shingrix, and that's the latest brand of the vaccine, even if you were vaccinated with Zostavax previously. And the reason for that is that the Shingrix vaccine has been found to be more effective in protecting against shingles compared to the Zostavax vaccine. Another difference is Zostavax is live while Shingrix is not. And a live vaccine, as Chris mentioned earlier, is a very weakened form of a virus, and it may have it has such a weakened form that does not cause any sort of infection with the actual virus. The difference between that and the killed virus or killed vaccines are that there's a protein or some small part, a particle that is what creates the immune response, and not a weakened form of the vaccine. So that's the difference between those two. And certain people with immunocompromised kind of conditions would not want them to receive a live vaccine. So this table here is the CDC's website and often available in your healthcare provider's office, and just helps with the discussion of what vaccines you would be needing at different points in your life as an adult. So you may ask, where can I get vaccines? Well, you want to discuss this with your primary care provider, especially if you've been diagnosed with chronic conditions. If you don't have a primary care provider or they don't offer the vaccines that you need, you can always get them from Passport Health and sometimes from your local health department. And in general, the only kind of contraindications to vaccinations that we really are looking at is that a vaccine should not be given to an adult who has had a serious reaction to a prior dose of that vaccine or any of its ingredients. So, and by serious reaction, I mean like anaphylaxis, or that's a severe body swelling that can even stop breathing. What's not necessarily serious reaction is having a mild rash or swelling over a small localized kind of area. The vaccine finder is also, that there's an image there at the bottom of the slide. That's also really great. You can put in your zip code and it will pop up different locations where you can get various vaccines.
So the one thing I want to stress about vaccines and where to find more information about them is that there are a lot of very popular myths about vaccines. So it's extremely important, and I can't stress that enough, that you are checking reliable sources for getting information on vaccines. We have some listed here. There are more, but these are probably some of the best resources to find more information about vaccines. So UCSF Health is one option, the Medical Library Association, Immunization Action Coalition, which is where we got a lot of the information for these slides. You can also get vaccine information statements on immunize.org. And that lists the vaccine's risks, benefits, as well as what to do in case of an adverse reaction to a vaccine. And vaccine safety is very closely monitored, and any data reported in the VAERS, which is the Vaccine Adverse Events Reporting System, and it's publicly available. CDC, Centers for Disease Control and Prevention, is a really excellent resource, also where we got a lot of the information for these slides. So definitely get some of the any information from the CDC. Health Map Finder, or the Vaccine Finder, which Alicia mentioned previously, is a resource to find vaccines and where they're available. The Immunization Action Coalition, again, a really great site for consumers and healthcare professionals. The American Academy of Family Physicians, or the AAFP, is another awesome resource. The U.S. Department of Health and Human Services, you can always go to that website to learn how vaccines protect you. And then the U.S. FDA is another optional resource that has a lot of information about vaccines. So to summarize what we just talked about, vaccines play a very important role throughout adulthood in preventing severe illness, complications, hospitalizations, disabilities, and deaths from vaccine preventable illnesses. Make sure that you're talking to your healthcare provider every single year about what vaccines are recommended, especially if you have any chronic conditions. And there are a lot of vaccine myths, so make sure, again, that you know how to find reliable, evidence-based resources for accurate and up-to-date information. Something else I want to just briefly talk about is that health and wellness are not just about vaccines. Vaccines are a very important part of it, but we do have personal wellness coaching available to you as a member of your organization's health insurance plan. So the below website is how you would get started with that. And just want to say a quick thank you to all of everybody that attended today's webinar. You're a grown-up, but you did not outgrow your need for vaccines. So just kind of keep that in mind, all right? And now at this point, we're going to stop the recording and we're going to take some questions.